When vaccines arrived, countries pumped in millions of dollars to buy enough doses. Rich countries blocked doses by pre-booking them. Pharma companies were more than happy to indulge. For them, it was like a pandemic windfall. But almost 2 months later, reality is hitting hard. The supply chains are too slow. Some countries don't even have the right syringe to extract the vaccine. And a certain Justin Trudeau from Canada, who wanted to wade into the farmer protests in India, has now dialed Prime Minister Narendra Modi, seeking India's help with vaccines.
Last year was a race to find a vaccine. And now that they are here, the world has new problems. In Japan, the government will have to throw away millions of doses. In Canada, they simply don't have enough shots. The problem of plenty in one part of the world, acute shortages elsewhere. Japan finds itself in a helpless situation. It has secured 144 million shots of Pfizer's vaccine, enough for 72 million people. That's assuming each vial contains 6 doses. But extracting that 6th dose is a tricky affair. It requires special dead space syringes with narrow plungers. Japan doesn't have many of those. It uses normal syringes which can only extract 5 doses from a vial. So once the vaccination drive begins, which is later this month, medics will have to throw away the vials after 5 doses. End result, millions of doses will be wasted. Doses that Canada could really use right now. They've ordered millions of shots from Pfizer and Moderna. But delivery has been slow. Moderna delivers to Canada once every 3 weeks. The next shipment is set to arrive on February 22nd. Canada's vaccination drive is on the verge of stalling. So Prime Minister Justin Trudeau dialed Indian Prime Minister Narendra Modi. He was given an assurance. India would do its best to secure the doses sought by Canada. It's an epic role reversal over 70 years. Here's a picture from 1947. India's first Health Minister, Amrit Kaur, is seen receiving penicillin cases from the Canadian Red Cross Society. Back then, the world community was India's only hope. Today, the world depends on Made in India vaccines. As Japan dumps its vaccine and Canada hunts for it, South Africa is looking for a barter. It says the AstraZeneca jab is ineffective against the new variant, so the rollout has been abandoned. But what will South Africa do with its massive stockpile? 1 million doses have already arrived. 500,000 more are expected soon. The health minister is talking about a swap, exchanging the AstraZeneca doses for those of another firm. And if that doesn't work, maybe sell the entire stock to a willing buyer. Since this whole episode is unprecedented, it's not clear whether the drug makers will agree to either proposal. As for the jab's efficiency, the World Health Organization continues to recommend it even against the new variants.
Even if there is a reduction in the possibility of this vaccine having a full impact in its protection capacity, especially against severe disease, there is no reason not to recommend its use, even in countries that have the circulation of the variant.
The vaccine rollout was always going to be a logistical nightmare. But the lack of global coordination is appalling. Vaccines are going in the bin or sitting idly in refrigerators, even as thousands die from the virus every day. Bureau Report, WION, World is One.
WION is now available in your country. Download the app now and get all the news on the move.